Hello, I'm Steve Hebrock, and I'm here to talk to you for just a few minutes about a topic that strikes fear in the hearts of horse owners everywhere: navicular disease. Now, the good news is that I'm going to offer the vast majority of owners who've heard those terrible words uttered by their veterinarian or farrier some very positive information. To begin this, let's get some definitions out of the way, because part of the problem is with confusion over the terminology. Navicular disease, or what I like to call genuine navicular disease, is a very specific type of condition of the horse's foot that I'll describe in a bit. But vets and farriers like to use a couple of other terms like navicular syndrome or caudal hoof pain or just plain navicular that really translate to pain in the back of the foot from unknown causes. They use these terms because the symptoms bear some resemblance to genuine navicular disease, but they're not able to make an exact diagnosis of navicular disease. But the terms themselves are confusing because they imply to most owners that their horse has genuine navicular disease, when in reality their horse only has some of the symptoms of genuine navicular disease. They can be caused by a number of other less serious and much more easily resolved conditions. So what are these conditions? Well, basically, anytime a horse seems to be sore in his forelimbs, where maybe his stride seems a bit short, or he's alternately pointing his front feet, in other words, resting one front foot with the heels off the ground, and then switching to the same stance in the other front, back and forth, and the vet or farrier can't find any other apparent cause, then it often gets labeled as navicular or navicular syndrome. And often the vet will back up their diagnosis by taking a radiograph and saying there are changes to the navicular bone or holes in the navicular bone. They may have also used hoof testers or nerve blocks to help confirm their diagnosis. Well, I'm here to tell you that all of that is practically meaningless and probably wouldn't be such a serious problem if it weren't for two things. First, what comes next for the horse, the inevitable wedge shoes, the pads, the drugs, and second, what doesn't come next for the horse, which is identifying and treating the real underlying causes of the horse's lameness. So let's talk about what genuine navicular disease really is. At the back of the coffin bone is this small bone, kind of funny shaped bone, called the navicular bone. It's not really a weight-bearing bone, but it's one of three so-called sesamoid bones in the lower part of the horse's limb. The other two, by the way, are up at the back of the fetlock joint. Now, these sesamoid bones function as pulleys. They redirect the motion of tendons. In this case, the deep digital flexor tendon comes down the leg and it crosses over the navicular bone and connects into the bottom center of the coffin bone. It's the tendon whose attached muscle is responsible for rotating the foot downward, and it's also one of the major players in the horse's suspensory system, literally holding up the weight of the horse and absorbing the shock of impact. The navicular bone is there to actually keep the direction of pull of the deep flexor tendon constant on the coffin bone, regardless of the angle of the pastern. By design, the horse's foot should make flat, even contact with the ground when the horse moves. Now, I know there are lots of people out there who are going to argue that point, but frankly, they're wrong. This idea that the foot should make ground contact in any way other than flat is based on some very faulty logic. And while I don't have time to get into all of the theory right now, I've written quite extensively about this on my website. And even if you can grasp the logic behind the points of this very simple and brief video, you're going to understand why anything but a flat landing simply cannot be healthy or correct for a horse. Now imagine what's happening inside the foot when it experiences that heel first or toe first landing. The heel or toe first contacts the ground, and then the foot is quite literally slapped down as it comes under load. That slapping motion results in a very rapid movement of the deep flexor tendon across the face of the navicular bone. And what happens when two things in contact with each other move very rapidly across each other? Well, friction, heating, and eventually damage to the tendon and the surface of the navicular bone where they cross. This damage is very much like any other joint damage, except it involves a tendon and a bone rather than two bones. So genuine navicular disease is essentially arthrosis of the navicular tendon joint. This repeated heating through friction caused by improper landings is causing excessive wear and tear on that joint. Having said that, it's also important to understand that if your horse actually has navicular disease, there's no cure for it. Just as there's no cure for a person with a worn-out hip or knee, there's no drug, supplement, no horseshoe that can cure a horse with navicular disease. As eminent equine pathologist and author Dr. James Rooney states in his writings, once begun, this disease process is irrevocable and unremittingly destructive. There is no cure, no return to normal. It is no doubt true that cures of navicular disease with any form of treatment reflect an incorrect diagnosis. One does not cure bona fide navicular disease. In other words, anyone or any product that claims to be curing genuine navicular disease is either lying or, far more likely, is treating a horse that's been misdiagnosed. There is no cure for navicular disease, but I said at the beginning of this that I was bringing good news, so let's get to that. In my experience, the overwhelming majority of horses diagnosed with the navicular disease, or with one of the other terms I mentioned earlier, don't actually have navicular disease. Because the damage starts out as essentially soft tissue damage, it can't be seen on a radiograph until it's progressed to a pretty advanced stage. But the various sorts of holes seen in the navicular bone on X-ray are not indicators of navicular disease, in spite of what the vet or farrier may lead you to believe. Again, navicular disease is a very specific form of damage to that tendon-bone interface, and the only way to diagnose it for certain in all but the most advanced stages is by MRI. So unless you've had an MRI done, I wouldn't put any stock in a diagnosis of navicular anything. Additionally, the damage is caused by overuse, misuse, and plain old bad hoof care, which is why feral horses never get navicular disease. It's strictly a human-caused condition. So factors like the breed of the horse, the age of the horse, what he's been used for, on what kinds of ground he's been used, and how often he's been used are very important in the diagnostic process. Since the condition is caused by repeated heating of that navicular tendon interface over a long period of time, in other words, it's a cumulative form of damage, like that caused by exposure to loud sound or exposure to heavy metals, we can exclude many horses from that diagnosis right away. For example, a middle-aged horse with anything resembling reasonable foot care that's ridden primarily on trail is highly unlikely to develop navicular disease. He doesn't jump, he doesn't do a lot of high-speed work on hard surfaces, and while his hoof landings aren't as good as they should be, the fact that he's being used at lower speeds means less heat from friction and therefore less likelihood of damage. On the other hand, a middle-aged horse that has a much less than ideal shoeing job, particularly if it involves wedge shoes or pads, and is used repeatedly for stadium-style jumping, is very many times more likely to develop genuine navicular disease. In fact, the two most likely situations for genuine navicular disease to occur in are with the horse that's shod and driven many miles on pavement and the stadium jumper. By now, I hope you're starting to understand the role of landings in the development of this condition. if the foot isn't landing flat front to back for whatever reason, there's a motion of the deep flexor tendon across the navicular bone as the foot comes under load. The worse the landing, the more heating occurs because of the longer and more rapid motion of the tendon, and the more likely the damage. So what other conditions can mimic the symptoms of navicular disease? Well, in my experience, the two most common ones are bacterial infections of the frog and chronically long heels, whether through bad trimming or wedge shoes or pads. And for whatever reason, vets and farriers seem to not recognize either of these as sources of pain for the horse. But if your horse has a deep split in the middle of his frog, and particularly if he's sensitive when you poke in there with a hoof pick, the infection is almost certainly the source of his discomfort. Likewise, if your horse is landing obviously heel or toe first and has been working on hard terrain, any lameness is probably from that. Here's where things get difficult, though. By now, I hope you understand that navicular disease is caused by improper landings over a long time period. What happens to a horse's landing when you raise his heels? He lands heel first. But pounding down on his heels makes him heel sore, which then gets misdiagnosed as navicular disease. And what do vets and farriers recommend for navicular disease? Yeah, raise the heels. Now his landing is even worse, causing even more pain. And on it goes in this vicious cycle that happens until, guess what? The horse actually develops navicular disease, which he didn't have in the first place, but ends up with because of the misdiagnosis and the incorrect treatment by the vet and the farrier. Because you can't cure genuine navicular disease, you really want to try very hard to never develop the condition. The best thing you can do is to find someone to care for your horse's feet who really understands the concepts I've talked about here and will trim your horse properly, which will always include a short, properly balanced, bare foot. So I'm going to try to wrap this up. In summary, genuine navicular disease is damage to the navicular bone and deep flexor tendon caused by repeated heel first or toe first landings over a long time period. Genuine navicular disease cannot be cured, but we can make the horse more comfortable by providing some pain relief through medication, some low-speed exercise, and properly balancing the foot for a flat landing. Anything else is either ineffective at best or actually exacerbates the condition at worst. Genuine navicular disease is much less common than vets and farriers would lead you to believe it is. History, use, and other factors weigh heavily in determining whether or not any particular horse is likely to have navicular disease. Radiographs are generally useless. The only certain test to diagnose navicular disease is an MRI. The most common hoof conditions that can mimic the symptoms of navicular disease are frog infections and sore feet from repeated heel-first landings on hard terrain. I hope this little video has given you at least some little sense of relief about the realities of navicular disease. There's a lot more information on my Enlightened Equine website, where you can download my series of articles on navicular disease under the printable article archive link. And you can also set up a consultation with me under the services link if you like. Better yet, consider coming to our Liberated Horsemanship Gateway Clinic this September at the White Stallion Ranch in Tucson, Arizona, where we'll spend 5 days covering not only the mechanics of proper hoof care, including 5 afternoons of heavily supervised cadaver leg trimming, but many other management factors contributing to healthy feet in horses as well. I'll be giving an extensive lecture on navicular disease using some video to show proper and improper landings, and you can ask me all the questions you want. Thanks for watching.